Welcome to Adapting Class, and thank you for deciding to watch this video. Are you in a nursing school or preparing to take your NCLEX? And if you're struggling to remember which congenital defect are cyanotic and acyanotic, then this video is for you. I want you to stick around. I'm going to break down the most high-yield congenital defect using mnemonic, easy way that you will never forget. This will include all the most testable congenital art defects that you need to know. Let's get to it in a straightforward way. First, let's look at this question. Think about it, take a picture of it. As we go through the mnemonic, you'll be able to answer it easily. The nurse is reviewing congenital heart defect. Which of the following defect correctly present with what? Cyanosis at birth. The key word is cyanosis. That means the blue at birth. Trancus arteriosus, Tetralogy of Fallot, tricuspid atresia, right? Atrial septal defect, ventricular septal defect, transposition of great vessel. Think about it, take a picture of it, and let's get to it and come back to it later on and see if we'll be able to answer it safely. The first thing we have to know, the first mnemonic is the 5 T's of cyanotic congenital heart defect. They are the blue babies. And what are they? These are major cyanotic blue heart defects. What are those? They responsible for shunting blood from the right side to the left because the right side has deoxygenated blood. Therefore, when they shunt the blood, the patient is going to turn blue right at birth. Therefore, we call them the 5 T's of the cyanotic congenital heart defect. They are the blue babies. What are those? Trancus arteriosus, right? Transposition of great vessels, tricuspid atresia, Tetralogy of Fallot, and total anomalous pulmonary vein return. There is something unique about them. Look at it. All of them start with what? T. Therefore, the 5 T's of cyanotic congenital heart defect, and they are the blue babies. Therefore, how do you remember them? It's the 5 T's. Tricky, transposition, triggers, terribly terrifying troubles, right? Terrifying troubles are the tetralogy of Fallot and transposition of anomaly of venous return. They are the most terrible ones. The first one is the tricky one. Then you get it transposed and trigger terrible, terrifying trouble. So if you don't know them, this is the mnemonic to remember them and remember which one. It gives you tricuspid, tricky, transposition, trigger, tricuspid, and terrible, terrifying troubles. This is the first congenital heart defect that you have to know in the 5 T's. The second one are the acyanotic. And how do you remember them? These are the acyanotic defects. Basically, baby can be born and they are not blue, right? Why? Because they shunt blood from the left side of the heart to the right side of the heart. That means the blood go to the lung again and again and again. This will lead to pulmonary congestion. Therefore, we call them the most common acyanotic congenital heart defect. What are those? Ventricular septal defect. That means there's a space between the two ventricles, right? And they shunt blood from the left to the right because the left side is stronger than the right side. A septal defect, the same thing. Defect between the two atrium. Blood is shunted from the left atrium to the right atrium. Patent ductus arteriosus, PDA. This is supposed to close. If it doesn't close, it starts to shunt blood from what? Left to right. And coarctation of the aorta. That means the aorta, there's a little bit of stenosis, and therefore your upper extremities, pressures are higher than the lower extremities. In the process, you're going to shunt blood from the left to the right. And the AV canal defects, you may not have heard it, but these are endocardial Cushing defect, and they are responsible for what? Left to right shunt. Very common in Down syndrome. How do you remember these guys? Valves and passengers, right? Valve is ventricular septal defect. A is what? Atrial septal defect. Passenger is the PDA. Count, coarctation of the aorta. avoid AV canal defect lead to what? Left to right shunt. So valves and passengers can't avoid left to right shunt. That is the mnemonic. Valves and passengers can't avoid left to right shunts. Now, I'm coming back to re-emphasize that cyanotic usually starts with T. That's the third mnemonic. Therefore, all cyanotic defects start with the letter T. And therefore, we call them T is terrible for cyanosis. That's the keyword. What are those? We've seen them. Trancus arteriosus, transposition of great vessels, triscarpate, what? Atresia, tetralogy of Fallot, total anomalies pulmonary venous return. Now, the biggest one and the most important cyanotic defect is tetralogy of Fallot. How do you remember them? It's called PROVE. So to remember PROVE, which is tetralogy of Fallot, that means there's more than one thing associated with tetralogy of Fallot. And therefore, this is what we call the 4 features of tetralogy of Fallot, which they may ask you. They may ask you, look, the first thing to know is one of the classic heart defects, cyanotic. So in order for NCLEX to ask you a question about cyanotic babies, they cannot ask you trancus arteriosus, anomalies of pulmonary artery. Those are so hard. The most classic one that shows a blue baby is tetralogy of Fallot. I have a video, I have a case study on YouTube. You should check it out. I give you all the details about it. Easy way to remember them is what? PROVE. And what is that? PROVE means what? There is going to be a pulmonary stenosis leading to what? Right ventricular hypertrophy. In the process, the aorta will override what? The left side, and therefore we end up having what? Blue baby. But how does the blood get from the right to left? Is through a ventricular septal defect. Once again, I have a video. I explained it in detail. But the major problem is the pulmonary stenosis preventing the right side to pushing blood to the lung. In the process, the right lung get bigger. As the right lung get bigger, it's going to failure. In order to compensate, the ventricle between the left and right opens up and push the blood to the left. Since the left ventricle is not working, what happened? The aorta take over, and that is the overriding of the aorta. The baby become blue. Therefore, know the PROVE of tetralogy of Fallot. Next one. There is some congenital defect that are associated with syndrome. That means you heard about it. You have Down syndrome, Turner syndrome. They have heart problem. What are those? Be careful, know them, put them at the back of your head in case you see a question. The first one is what? Down in the AV canal. Down syndrome in the AV canal. So I call them Down syndrome is associated with what? AV canal defect. And this is the one of the defects that we saw associated with what? Left to right shunt. This is an endocardial what? Cushing defect associated with what? Atrial septal defect and a ventricular septal defect. So there's 2 defects. When they give you a question on the Down syndrome patient, they have atrial septal defect, ventricular septal defect. These are what? Left to right shunt, and the baby are not blue. What is the next thing? Now, other syndrome associated with congenital heart defect are these 3 to know. Down syndrome, AV canal, right? Turner syndrome is associated with what? Coarctation of the aorta. And then touch. Remember, Rubella, the reason why we give the baby, we make sure mommy has immunization against Rubella or any of the touch guys, right? That's infectious disease. It can lead to congenital heart defect, and that is the PDA. These are easy way to remember all the congenital defects. Now let's get back to our question that we did. This is the question, and then it's reviewing congenital heart defect. Which of the following defect correctly present with a cyanosis at birth? The cyanosis is associated with the T, the terrible T's, right? Therefore, anything that has a T in the beginning, don't even think about it. Just pick it. Trancus arteriosus, number one. Tetralogy of Fallot, the classic one. Tricuspid atresia, number three. Atrial septal defect does not start with T. Ventricular septal defect does not start with T. Transposition of great vessel starts with T. Therefore, 1, 2, 3, and 5 are your answer. These are the mnemonic to remember all the congenital eye defect. If they're bothering you, I want you to watch it multiple times. If you need details, I have a video associated with it. I will link it with this video. Take care of yourself. Good luck in your exams.